I have come across so many patients who tell me that a 55 or a 60-year-old doctor, and there's nothing against senior doctors, have told me that यार protein supplement तो लेना ही नहीं चाहिए, ये artificial है.
Hello and welcome to the Kids Stop Press podcast. Today on season 4, we are welcoming our first dad of the season. He's all of 5 months old in the parenting journey. He's a debutant author. He's also a health creator and an orthopedic surgeon. We're talking of none other than Dr. Manan Vora, who is also a health educator, co-founder of the NutriBite Wellness. He is also a PhD scholar in regenerative orthopedics and has been recognized with multiple awards, including the prestigious Edinburgh Surgery Global Scholar Award. When he's not treating joint pains, he's seen as creating some really informative and educational content on his Instagram handle, which boasts of followers of upwards of 400K. So let's welcome Dr. Manan Vora. You said a very important thing about supplementation, and I feel sometimes it's very tricky because your doctor doesn't know what your goals for yourself are. So how are they going to guide you for supplementation? Like they will do the blood routine and it'll be like, okay, D3 is okay, B12, okay, this routine seems okay, but they don't know what your goals are.
Correct.
And I see so many people mentioning, oh, you must take creatinine for this, and you know, if your aim is this. Tell me what's on your supplement stash.
Okay, so you mentioned doctor, and I'm going to go out, openly and even say this. I think very few doctors know enough about all the supplements that are out there, right? And I think we need to accept this as a flaw or a limitation. That's a better word to use, because while we are taught about vitamin and mineral deficiencies in our medical school, we're not talking too much about protein supplementation, creatine supplementation, and all the other nutritional ones that come in, which probably the nutritionists are also very good at now. Unless a doctor is in the know-how or has read beyond what medical school taught us and is actually up to date with everything, they will most likely not have a good opinion on this. I have come across so many patients who tell me that a 55 or a 60-year-old doctor, and there's nothing against senior doctors, have told me that यार protein supplement तो लेना ही नहीं चाहिए, ये artificial है. Now protein supplements are absolutely natural. The protein powder that you consume is absolutely natural. Breast milk has whey protein. If breast milk has whey protein, why are you telling a patient not to have protein powder because it's whey? So doctors, many of them don't even know the entire filtration process, how whey protein is done, because it's not something that we're taught. I don't blame them. But they'll have a standard line because somewhere they've heard from someone and they are also following the myth that protein supplementation is harmful. Creatine, क्यों चाहिए आपको creatine? Are you a professional athlete? So many doctors actually think that creatine is a banned substance. They don't even know that creatine supplementation is excellent for mental cognitive health. It is excellent for your brain health also, and excellent for athletic performance and output. Absolutely safe to take. So actually, in fact, I've covered at least 10 supplements in my book, and I hope doctors read this also, because even though the book is completely addressed to the common man, there is so much information out there that even doctors may not have known. In fact, I'll be open and say that out of 101, there were 5 or 6 myths that even it's not that I thought they were myths, but I got to learn so much more when I did research about them. Even I didn't have answers to all 101. So that's how vast the topics are. But coming to my supplement stash, whey protein for sure. I'm a veg plus egg eater. It's very difficult for me to hit my protein goals if I'm not eating meat, but it's not impossible. But I choose to consume whey protein because there's only so much paneer tofu that I can consume. There's only so much I can have throughout the day, and based on my weight and the goals that I want to hit, I need whey protein. Second, creatine monohydrate. I do not go without 5 grams of creatine monohydrate, and this is the most researched supplement in the world. And I know doctors or health content creators sometimes leave a disclaimer that consult your doctor or nutritionist before taking this supplement. I can say with confidence, every human listening to this, irrespective of your age, adults, should be on 5 grams of creatine monohydrate every day till the day they die. Even if you are 85, even if you are 45, even if you are 25, even if you are a man, even if you are a woman, anyone, even if you are exercising, even if you are not exercising, and it is not an expensive supplement. 5 grams creatine monohydrate every day. I'll say this for this one supplement, please consume it. So that's creatine monohydrate. When it comes third, I think omega 3. 100% big yes for me. And again, something everyone can consume, because it's very difficult even for a non-veg eater to say that I'm having itna seafood that I'm getting all the omega-3 that my body requires in a day.
Yeah.
So these are three that I think are non-negotiable and you don't really require a doctor's prescription for. Apart from them, based on my dietary preferences, my goals, I also take magnesium. I also take a vitamin D3 and K2. But yeah, these are probably the 5 common ones. Sometimes maybe a vitamin B I'll add, because again with vegetarians your vitamin B, B12, B6 not going to be that high.
Right.
But I'm not that regular with it. But these are the 5 that I consume personally. The first 3 definitely everyone can consume. The others based on your requirements, based on if it's something you need to take.
Right. And any recommended timing that you would recommend? Because I feel like everybody talks about the supplement, nobody talks about the right time to
Correct.
take it.
Correct. So when it comes to whey protein and creatine, these are more about your body's daily intake. You can take them anytime. There's a huge fitness thing that, oh my god, gym se nikalte hi 10-15 minute ke baad protein shaker mein, like there's actually people who will not even wait to go home and have their protein powder, because so they'll carry the shaker,
Yeah.
they'll add the water outside the gym and have it, because someone's told them that for maximum efficiency within 10 to 15 minutes have your protein powder.
Yeah.
There's no such thing. As long as you're getting the amount of proteins during the day, yes, I do agree there is some logic to having it after a workout, because your body needs a good source of protein post your workout.
Yeah.
But whether you have 4 eggs or whether you have paneer or whether you have whey protein, your body's still getting the protein. You don't need to have it just 10 to 15
Yeah.
minutes later. So protein and creatine throughout the day whenever you want. When it comes to omega-3, you should generally have it with a meal that has a decent amount of fat. So generally your lunch or dinner will have some fats, obviously. You will not have only a protein and carb rich thing. So post lunch or post dinner, usually post lunch is when people have omega-3. When it comes to your fat soluble vitamins like vitamin D, generally had after a good breakfast. And when it comes to vitamin B, and those are water soluble, you have it before food. So this is roughly the time when you will consume them.
Right.
Parenting tips, celebrity interviews, recipes, conversations with experts, DIYs, and lots more. Subscribe to Kids Talk Press now.